Daisy Award. This is a big, big deal. So celebrating all of the nominees tonight. So pretty awesome. Daisy Award really aligns with Mason Health and what we try to do in terms of really the service and relationships and our values. So really, really appreciate that Nadine brought this to us, this idea. So, well, and she's pointing to Rob and Mel and like their sponsorship, and they're willing to get along with my idea, but pretty awesome. So thank you, because really celebrating, because it's a hard but very rewarding job, nursing, and so really taking that time to honor our nurses, I think, is really amazing. So just want to thank you, and thanks for coming tonight, and thank High Steel Beer who catered. Want to thank the nominating committee, the Daisy committee, for going through, because it's actually a very intensive process going through all the nominations and coming to this point. So thank you for all of that work, a lot of work there. And then our wonderful development office that basically sets up this amazing event. So thank you for all the time that you put into this as well. So with that, I will hand it off to Mel. She's going to do opening and closing remarks.
I love both. I'm already nervous. Okay. So I just wanted to say a few words. Again, thank you to the committee. Nadine, you took it, you ran with it, you made it from here to here in a very short time. So very appreciated. And I just want to say, you know, I don't know any nurse that goes into it for the money or because of the status. We do it because we care. And we're working weekends and we're working holidays and without thanks. And we don't need it, but it sure is good when there's an international award for being a nurse and just doing what you do every day. So with that, we will get started. And thank you all for coming too and supporting the nurses here.
Where am I standing? Chris keeps me organized and does everything. Oh, I guess I should introduce ourselves. So I'm Nadine Cran, the ICU supervisor, and Chris Ga, birth center manager, and so co-chairs of the new Daisy committee. So very excited to bring it to Mason Health. Many of our committee members are here with us. So what are the Daisy Awards? Daisy Awards are an internationally recognized award that distinguishes nurses for their excellence in nursing and patient care. So we'll have up to 4 awards a year. Nurses will be nominated by patients, families, and coworkers and chosen anonymously through the Daisy Award Committee. Oh, mine? Okay. So the Daisy Foundation, it actually stands for...
Oh, you're going to do it? Just got it.
She's got it. Okay. It stands for Diseases Attacking the Immune System, founded in, I believe it was actually 1999, but 2000, in memory of J. Patrick Barnes, who died at 33 from complications of idiopathic thrombocytopenia purpura. This is his family that you can see here, many of his pictures. Pat Barnes' legacy, whenever he came across anyone in need, he never turned his back. He reached out to comfort and to make them feel okay. So the Daisy Foundation was established by his family to keep his spirit alive. 2 of the foundation's goals related to nurses because Pat's family was awed by the care and compassion that he received from the nurses during his hospitalization and that his family received during his hospitalization. Recognize the extraordinary work nurses do every day, and they fund research.
So, the Daisy Award works by people nominating nurses, and they have to be a nurse. I will tell you, actually I'll say this ahead of time, we actually have somebody here now who has, from here going forward, we're not going to be including anybody in an administrative role of any kind. So they have to be a staff nurse. We do have someone here now who has a leadership role, a supervisory role, but at the time she was nominated, maybe not at the time, but by the nominator, the nomination came from a time when she was a staff nurse, so we included her in the nominations tonight. And you'll see who that is later, probably. So this works by, oh, is this our Mason? Oh, we didn't put up the ends. So we developed a rubric down here, and when we get nominations, it's the job of Nadine and I to go in, we're the only two that have access to those. We go in, we de-identify all of the nominations so that when we pass those on to the committee, they don't know, they don't see any names, they don't know who it is. If it is a manager, we ask them, if it's a supervisor who knows about a specific instance, we really ask them to step back and not really vote necessarily on that. But this time we didn't have to worry about that. So we developed this rubric with our team, and you can go through it when they are reviewing these. They want to make sure that each nominee meets these expectations that we kind of set out. So you guys can read these. M, modeling empathy. A is for attitude. They always have this great attitude. S is the service role model. They're serving as a role model for the nursing profession. O, they observe and incorporate Mason's Mason Health's mission, vision, and values by going above and beyond to ensure that our patients and visitors get the care that they really need and want, and that they feel respected and valued. And then N, that they nurture and advocate for patients. So nurses are constantly having to advocate for patients. You know, we're kind of the eyes and ears for the providers, and oftentimes things aren't necessarily going their way, and it's our job to be able to go to the provider and say, hey, you know, we need to talk about this plan. So they're advocators. What is the impact of Daisy? It's kind of threefold. It helps to create a healthy work environment by really increasing nurse engagement, letting the nurses know how important they are and what a great job they have done. Like Mel said, sometimes it's a thankless job. Not always, we do get thanks. But you know, when people are nominated, it really does go to show, just not the nurses who are nominated, but other people, that the patients really do think about the care that they're getting. Down there, I like, you said that too, Mel, earlier, it reminds us why we became nurses. And then these two things really also lead to patient and family experience, because you know what? When the nurses feel that they are valued, they're going to give a lot better care too. And also the patients and families love to be able to give us that feedback. You know, we do callbacks, a lot of the units do callbacks, and they love to tell us all about the care that they received. And I'm going to let Nadine talk to you about this because she has more of a personal experience to share.
So here at Mason Health, we take great pride in our nurses and the care they provide every day. Daisy Awards will be a great benefit to our hospital by recognizing, like Chris and Mel and Eric pointed out, recognizing the contribution our nurses make to our patients, the hospital, and our community. In today's climate and what we've just been through, it's so important that we recognize those heroes every day, our nurses. And I was, I really took this and ran with it because I'm a two-time Daisy Award winner myself. And it meant a huge deal to me when I received it, and the family recognizing the work that I did. So I just really want to pass it forward and honor those nurses that do an amazing job.
What is the honor of?
Oh, yeah, sure. What does the honoree receive? So it's actually quite incredible. Other than the public celebration, the certificate and this beautiful hand-carved healer's touch sculpture, the honorary pin, there's actually an incredible benefit to receiving the Daisy Award, which I recently found out. It's a tuition reimbursement for going forward in your nursing career, so it's pretty significant. So I'm going to be starting nurse practitioner school in May, and it actually has taken a considerable amount off my tuition, so that's a big deal because these are internationally recognized, so that's one of the bigger benefits. The cinnamon rolls, to be shared, are because Patrick Barnes loved his cinnamon rolls. So they would sneak him in cinnamon rolls when he was in the hospital. We as nurses know it's not right, but they did it. So this is what they receive. And this Shona sculpture, hand-carved by the Shona tribe in Zimbabwe. They have a profound respect for their traditional healers, and they're regarded as treasures by those they care for. And this just tells of all of the things that you can receive, the grants and, all right. No, that's all right. Nursing grants, key nursing benefits. Anyway, yeah. So at this time, we would like to recognize our nominees with certificates and pins. We have a list? All right. Becky Bingham, RN Emergency Room. Becky has also been a resource nurse, so you'll see that it says that in there, but she's in the emergency room now. So lucky Christina. Leah Coleman. Matthew. RN. Rosalind is not here, so if Carol, would you come up and accept her certificate? Rosalind Griffin, MSP. On the back of each certificate, is their stories. So each nominee, their family or person who nominated them told a story, pretty significant stories actually. So if they wanted to share those after. Joss is not here, so Christina, if you would come up. And Josh, sorry, Josh Meagley, RN-ED. Bronwyn is not here, so Marissa, if you would come up. Bronwyn Kennedy, RN in wound care. Kim Neiswanger, RN. Currently Kim is in the walk-in clinic, but Kim has done med-surg as well, so. And outpatient, yeah. Taylor Reeb, emergency department. I think they're taking the show today. What's up with our ER nurses? Wow. Michelle Rose, RN wound care. I would really like to share that, Michelle, your story made me cry a lot. It was incredible. Patrick Santos, RN emergency room. Marika Thomas, RN birth center. Tracy Wiley, RN Birth Center. And actually, we're gonna have all the nominees come back up if you just wanna stay there for a second for a picture. All the nominees.
Before I announce the name, I'm going to read the story from the nominee. It's not super long, one page. You'll kind of be able to guess a little bit from the story, but this person helped me while I was delivering my first baby.
I don't know if I can read it.
You want to try? I'll try. We're all criers though. All right.
This person helped me while I was delivering my first baby. She was there for me when I didn't have a clue what I was doing.
Okay, here it comes. We can't get past the first sentence.
All right, she took care of me and my baby and was so kind and compassionate. We established a lovely relationship in the weeks following that delivery as I needed additional postpartum care. She was also extremely helpful in researching a condition my child had been born with that other medical professionals didn't really know about. When it was time to have my second child, I was absolutely at ease when I knew this person was on shift and could be there to assist me in that delivery. This was during the height of COVID, and that brought forth a whole different set of complications, but she was there for me and my family when my family couldn't be. This person advocated for me and my children. She was empathetic and helpful and really put me at ease. Being in labor has a way of taking your dignity and modesty, and this person made sure I never felt embarrassed and that I was comfortable throughout the process. It was truly life-changing care, and I'm so thankful.
Ooh, that was tough.
Please come up and receive your award, Tracy Wiley.
There's some more right there, Tracy. No. You got lots of stuff.
Congratulations to inaugural Daisy Award winner Tracy Wiley and all of our nominees.
Thank you all for coming. There is still food out in the back, and if you hear anybody in the community talking about great nurses, make sure they know to nominate.